Piriformis syndrome exercises do not exist, and in 30 seconds, I can prove it to you. You see, most people believe that you need a medical diagnosis like piriformis syndrome first so you can treat and fix the problem. But going down the path of getting x-rays, MRIs, nerve tests, or waiting months to see a specialist in hopes of getting a crystal clear diagnosis almost always results in a dead end, especially if you want to treat the problem naturally. And so in this video, I'm going to quickly prove to you that piriformis syndrome exercises do not exist, and then I'll share with you a better way to fix the pain in your butt using movement as medicine. My name is Dr. Charlie Johnson, physical therapist, and after evaluating over 10,000 back, butt, and sciatic pain cases, I have a challenge for you watching this and you sitting here with me as well. What I want you to do, because you've been told you have piriformis syndrome and you believe that now that you have this diagnosis, you can fix it with specific piriformis syndrome exercises, I want you to do an exercise that only moves the piriformis muscle, but here's the rules of the game. You can't move anything else. Don't move the other glute muscles, don't move the disc, don't move your hip, don't move the nerves, don't do anything but only target the piriformis muscle. You can't do it. And because you can't do it via traditional, say, figure 4 stretches, which move the hip, which move your arms, which move your neck, which move the discs and move the back and move the nerves and all those other things, you must agree that diagnosis or piriformis syndrome specific exercises do not exist. But here's what does. So instead of treating medical diagnoses like piriformis or deep gluteal syndrome, I treat movement diagnoses. This allows me to treat people, not pictures. Now, a movement diagnosis is simply a motion which reproduces your symptoms, and most people who have a pain in their butt due to piriformis syndrome or whatever have at least one of these 3 motions that are painful, maybe multiple of these 3 motions. And what I want you to do is I want you to just sort of walk along with me as I go through these motions. I'll show you what they are, and just identify the most painful or what I call yucky motion, and take a snapshot of what that feels like, record it either mentally or on a piece of paper. So the first motion that is often yucky or painful is a back bend. And we're gonna go in 3 different directions to make sure we don't miss anything on the back side of the body. So what I want you to do is I just want you to put your feet about shoulder width apart, hands on your hips, and just bend straight backwards. And you're just getting an idea of, does it reproduce the pain that you feel in your butt? So often people with a pain in their butt don't have any back pain, but when they do this motion, it shoots pain into their butt, which tells you it's a back problem, kind of sneaky. So that's the first backwards motion. Was it painful or was it not? Now what I want you to do is I want you to perform what we call a rotation extension test. So rotate fully to the left and bend straight backwards. Make sure that corner is clear. Is that yucky or not? Rotate to the right, bend straight backwards, and that completes the backwards bending motions. We check the back corner, straight back, left, right. We see if anything reproduces the buttock pain or the leg pain that you're experiencing. Now, the second most common yucky motion is a figure 4 motion. Kind of ironic that this is what they give you as a treatment to make you feel better, but it is most often a painful motion for people with a pain in their butt. So go ahead and try to get your leg into this figure 4 position as if you're putting your ankle up on your knee. And you can compare side to side if you want, because it's natural to feel a little stretch. But again, we're looking to see if it's painful and if it reproduces your butt and or leg symptoms. So if it's painful, keep an eye on that, write it down, take a snapshot of what that felt like. The last motion, which is often painful, is a leg raise. A leg raise stretches the sciatic nerve and is often painful when people have sciatica, and piriformis syndrome often causes that. So go ahead and you pull your toes up and you attempt to raise your leg up. Good. And then do it on the other side and just get an idea if, again, that's a yucky motion. Does it reproduce your symptoms or not? Those are the 3 most painful motions. And now the cool thing is that instead of treating piriformis syndrome or any diagnosis for that matter, now we found and identified a yucky motion, and this becomes your movement diagnosis. Instead of saying that you have piriformis syndrome, which is really difficult to treat because it exists on an image or on some paper, somebody told you that was wrong with you, this is so much easier to see, feel, and understand. We can say, hey, instead of trying to fix piriformis syndrome, now the entire goal of treatment becomes to fix a yucky back bend or a yucky figure 4 or a yucky leg raise. And that's the value of finding a painful motion such that now we can translate the medical diagnosis into something you can better see, feel, and understand, and then we can aim to fix it immediately in the moment. Now, once we've identified your movement diagnosis and are detached from a medical diagnosis like piriformis syndrome, all that exists are a pharmacy of different movement pills that one could potentially use as medicine, with the goal being to fix your painful movement and eliminate your movement diagnosis, not get rid of piriformis syndrome. And the reason that this is so important is because your painful motions show up in life in ways you don't know yet. For example, if you have a painful leg raise, you won't be able to do any of these things in your life pain-free until you unlock it. So how we come up with these different movement pills or motion options within this pharmacy is pretty straightforward. So your body can move in 6 different directions. Consider the cardinal planes: forward, backwards, right, left, and it can twist or rotate to the right and to the left. You also have 6 roughly different positions you can place your body in to perform motions: lying on your back or on your belly, standing, sitting, on all fours, or even kneeling. Then we've got a top and a bottom if you consider the pelvis as sort of the hinge point or the divider, whereby you can bend forward from above as if forward folding, and or bend forward from below as if doing a knee to chest. And then you've got the right and left side of the body, and these different elements make up the available motion options. All these elements combined, the movement pharmacy looks something like this. So now we've got your movement diagnosis or painful motion, which you're trying to fix. And we've got this movement pharmacy with a sea of possible motions that we could use as medicine. But how do I identify what will work best for you? First, I want to emphasize what I mean when I say movement is medicine. You see, the goal of taking any pill or medicine is never to take as much as possible, it's to take as little as needed, if any. And the same should be said about motion. The goal is not to do an entire sheet of exercises or movements to try to resolve your pain. Our goal here is to identify one motion that is safe, pain-free, immediately effective, at a prescription that works for you. Now, in order to identify what movement pill will work best for you, it all comes down to testing. Just like an artist uses complementary or opposite colors on a color wheel to create contrast and really make things pop within a picture, I like to use opposites when it comes to using movement. So when it comes to selecting the best motions or places to start when it comes to using movement as medicine, I want you to think of first opposite direction, then opposite approach, and opposite side. This is again how we can tell where we need to begin and the best place to begin amongst the sea of movement option. So based off this law of opposites, the 3 motions that we're going to recommend you start with, and I'll explain why here in a moment and how to test them, is the clamshell or figure 4 strength, what I call figure 4 strength motion, the seated forward bend, as well as the figure 4 stretch on the good or pain-free side. Remember, opposite side. Now let's test each of these one by one to prove that they're not only safe motions for you, but that they're going to be immediately effective. So in order to determine the opposite recommendation, which might be best for you, we need to go through a testing process. So step 1 is we're going to test your yucky motion or your painful motion just one time. Then we're going to treat using the opposite recommendation. We'll walk through this step by step. And then we will retest the yucky motion, the painful motion, to see if the opposite movement pill actually makes it feel better. Here's what it looks like. So you take your painful motion. It might have been a back bend in one of the 3 directions. It may have been the figure 4. Let's just say for her, on her right side, she had a painful, yucky figure 4, or maybe it was the leg raise. Take whatever yucky motion you have. Go ahead and test it just one time. Get an idea for how well that thing moves, and then the degree of symptoms you experience while you're doing it. That's it. Step 1, find a yucky motion, take a baseline, take a snapshot of what that feels like. Step 2, treat using the opposite recommendation. So the first thing I recommended was opposite approach. Instead of lengthening, try shortening. So we do figure 4 strength or clamshell. And what I'm going to recommend is that you hold this exercise 3 times. We're going to do holds, not reps, 3 times until you're fatigued. So also some form tips here. Put your heels, put your butt, and your shoulders or your back should all be in a straight line. If you're having trouble keeping the form, sometimes putting your hand here helps, because oftentimes when people open it up, they rock backwards. So that's a no-no. Keep your hand here, keep it rolled forward, and you'll notice a little bit of a tipping point, whereby if you go a little further, it starts to rock backwards, and you stay there. Okay, so you hold it there. You can also put yourself against a wall if that helps you keep the form. So you do 3 holds until you're fatigued. If you're doing this correctly, you'll feel a lot of work in this area. Step 1, it must be pain-free. So that's the first rule. Most people don't respond to doing things which hurt over and over again. So we want this motion to be pain-free and or safe. We did 3 holds of the contraction or shortening until she was tired, and then we immediately retest her yucky motion, or you would retest your yucky motion. Maybe it's a back bend, a leg raise, or a figure 4. And something will happen. 1 of 3 options. It'll either be same, it doesn't make a difference, better, or worse. And for the sake of simplicity in this video, if it was same or worse, we're not going to do that exercise. If it was better, in this case, it looks better, she can move further, maybe it feels a little bit more at ease or relaxed, then we can bottle up that motion and use it as medicine. So then she would go home with a motion that she knows is safe and pain-free, doesn't hurt, and is very unlikely to make her worse. And the second thing is we can give her a prescription. So now she's going to do 3 holds until she's fatigued twice a day. And that would be her recommended starting point. And if any point over the next 7 days, usually I have people test a movement pill for 4 to 7 days, let's just say a week, again, for the purpose of this video. If at any point it will become yucky or make you worse, you just stop. And there's many other movements within the sea of the movement pharmacy that we could test. Now, let's just say if the opposite approach wasn't pain-free and or didn't make you immediately feel better, now we're on to opposite direction. So most people have piriformis syndrome or pain deep in their butt, or again, doesn't really matter what it is at this point, have a yucky or painful back bend, which shoots pain into their glute region. Now, if you don't have that as a painful motion, that's okay. You can still give this a try and test it as I recommend here. So again, same process applies. What we're going to do is we are going to go ahead and test your yucky motion. Maybe it is a back bend, or in this case, maybe it's a figure 4. You get a snapshot for what that feels like, a baseline. Now think, what is the opposite of backwards bending? Well, it's forward bending. So let's go ahead, and that's going to be, again, the second motion that we're going to show you here. So what I recommend to actually walk through testing this is that you sit with your painful side kind of off the edge of the chair. What does that allow us to do? It allows us to remove the element of compression, which often causes symptoms deep in the butt if the piriformis or sciatic nerve or whatever it is irritated. So just hang the cheek off, and then go ahead and try to bend forward as if you're trying to palm the floor. Now, if you can't palm the floor, you can get a yoga block, you can get a stack of books, something like that, or just do this. Put your hands here for support, go ahead, bend forward, or you can put your elbows, just something like that where you're feeling a little stretch in your lower back. Again, it should be pain-free. If it's not pain-free, then immediately we stop doing this. If it is pain-free, then we can do 3 30-second holds. And then what we can do is we can immediately retest the yucky motion just one time to see if it's same, better, or worse. If it is better, then we can bottle that up. We can do 3 30-second holds. I recommend up to 4 times a day. If it's same or worse, we don't do it. Now, one other little tip. Go ahead and bend forward for me, please. So let's just say that you're down here, you're flexed forward, and this feels okay, but oftentimes here's what happens, and you did it. Go ahead and sit on up for me. Oh. Sure. Yeah. Okay. Go ahead and do it the way you would normally do it, right? So sit on up. Yeah. Most people, they don't use their hands for support coming on up. So oftentimes what they say is oh, that's a painful, problematic motion. And the motion itself, when they're down in the position, is fine, but it's the coming up, which, by the way, is a back bend. It's a back bend returning, right? And so little sneaky, be careful there, all right? Don't mistake that as a painful motion if just the return is painful. Instead, go on down, put your hands here to push on up and use your arms to take away the stress off the lower back on the way up. Just a little tip for the exercise there. And if neither of the first 2 opposite recommendations work because either they were both painful and or they didn't make things immediately better, then it's time to move on to the third opposite recommendation, which is opposite side. So let's just say you have pain on the right side. We're going to do something on the good side or the pain-free side to see if it fixes the bad side. So her yucky motion was a right figure 4. So we always start with testing to get a baseline of what that feels like. Now we go and we treat using the good side, the opposite side, to see what happens. So in this example, I would recommend you go ahead, again, pick the opposite side of your pain. So you have pain on the right side, do it on the left side, do it on the right side. 3 30-second holds of the figure 4 stretch. Again, if you're doing this, you should feel a stretch in the butt cheek on that side. You could do it seated, but if seated is too painful, you could also do this lying down. So we could do a little modification. After 3 30-second holds of treating it, now we go and we retest to see if treating the good side improves immediately in the moment the bad side. And if it does, well, then we know this is something we can bottle up and use as medicine. We can slap a prescription on it. The dose, how much, is going to be 3 30-second holds. The frequency is going to be 3 times throughout the day. And the timing of when we do it, well, do it right before you know something is going to be problematic or painful for you. So there you have it. Proof that Piriformis Syndrome exercises do not exist. And also a better understanding of how to identify your movement diagnosis and fix that using movement as medicine. Hopefully this was helpful. Let me know your thoughts below in the comments. And if you're interested in other natural ways to relieve your back, butt, or sciatica pain, be sure to check out my other videos on the topic. Thanks.